Hi everybody, I'm Jennifer Walker.
I'm Callie Saltero.
And I'm Wanda Young.
We're going to be giving a presentation on hospice nursing. We're going to review some of the primary activities that are performed by this nurse, the scope of practice, teaching and learning strategies that they use, their educational preparation, interaction with other disciplines, and their required skills and abilities that they need to do this role, and some did you know facts. So for the primary activities performed by this nurse, a hospice nurse cares for patients at the end of their life. Their main responsibility is to help people live as comfortable and independently as possible in their final days, and this is with the least amount of pain. One of the largest parts of being a hospice nurse involves the patient and families and making sure that they're comfortable about the death process and providing them with the emotional support that they need. So for 24-hour nursing care, they do all the normal things that a nurse would do, assessment, documentation, medication administration, vital signs, all of these types of things. They work in collaboration with other disciplines such as physicians, social workers, and chaplains. Callie will discuss this a little later on in the presentation. And they provide comfort in all types of ways, whether it's in positioning, repositioning the patients, pain management, or massage therapy. And they provide the highest quality of life for these patients with compassionate listening and counseling patients and their family members. And they have expert pain management skills. So for the scope of practice, whether you're an LPN, RN, nurse practitioner, or a doctor of nursing practice, you follow the scopes and standards of practice that are given by the Nurse Practice Act. It's very important for a hospice nurse who works independently, like in an in-home environment, that they know their standards and scopes of practice, so that if a family member or the patient were to ask them to do something, that they know what they are and aren't allowed to do. For teaching and learning strategies, it's very important that the hospice nurse assess how not only the patient learns best, but also the family member. So if they learn best through, verbal and written type teaching, that we provide that to them. It's also important that we involve the family members so that they can feel adequate in taking care of their loved ones in their final days. We need to be aware, hospice nurses need to be aware of their own feelings regarding end of life. So when it comes to taking care of the patient, we're not only comfortable in giving the physical care that they need, such as medications and things, but also sitting down and having a compassionate conversation with them about end of life. We need to know the patient's wishes and any cultural awareness. So if there's any cultural needs that they would like to have, we need to be aware of that and provide that in the best way possible. And it's also very important that we convey compassion, respect, and acceptance to these patients. We may come into a situation where we don't completely agree with the choices they made in their end-of-life care, but we need to respect and have acceptance towards these patients.
Hi you guys, I'm first going to talk to you about what education is needed to be a hospice RN. You can be an LPN or hold your RN license, ASN, BSN, MSN, or DNP programs. You can be a hospice nurse with all of these. Training-wise, after 2 years of being a hospice nurse, you can sit for the Hospice and Palliative Care Certification test. This certification carries on with you and you have to renew it every 2 years. Also, you need to take classes in pain management and end-of-life management. These classes can be provided to you through your hospice facility or online. For the next one, it would be RN interaction. RNs interact on a daily basis with a multitude of people. Your physician, especially, you get your orders from your physician. Then you go and carry out your orders. If you have an issue when you're at the home with the patient and you need new orders or some advice, you would call your physician up. The nursing assistant is somebody that the nurse works with hand in hand in the hospice care setting. You give your orders out to your nursing assistant, such as bathing, turning, toileting, helping the patient up, cleaning the patient up, feeding the patient. The social worker and the RN case manager, these people are the ones that help set up funeral arrangements for the family and the patient themselves. They can transfer the patient from in-home settings to inpatient settings or even transfer them for inpatient respite care. The chaplain is one that comes in and just helps with the family's spiritual needs. The RN can call them and reach out to them anytime, day or night. There's always a chaplain on call. Therapists such as occupational, physical, and speech therapists are available on call to the RN for the family and the patient. The physical therapists come in and teach the family members how to properly turn, sit, stand the patient, and safely do this for the patient and the family member. The next one is a dietitian. The dietitian comes in and recommends appropriate diet for the patient, appropriate texture-wise, and also if the patient's on a tube feeding therapy, they can recommend which tube feeding they need. It helps with the swallowing to assess the patient if they can swallow. And volunteers come in and they offer companionship to the patient. They run errands for the patient, and if they're specially trained, they can even help take care of the patient in their daily needs.
And I'm going to be talking to you about the special skills and abilities of a palliative / hospice nurse. And with that, it's the same as a regular RN nurse. The only thing is that you're more working with alleviating the suffering of pain, and you're working with the individual, the family, and the communities. You need to understand the natural trajectory of illness and conditions, and you need to have critical decision making. And you also are managing the treatment of serious and life-threatening conditions, including symptom management and end-of-life care, and you're working with your team of physician, your nurse assistant, your case manager, your social worker, and your chaplain. You need to have advanced care planning. You need to help the patient and family set goals of supported care, and you need to understand the hospice and palliative care service that the facility provides. Did you know that in hospice there's three different types of services? There's the in-home care, the short-term inpatient care, the crisis intervention, and the short-term. I'm sorry, I said three, it's actually four. In home care, you have a team that goes out into the patient home, and they're assisting the patient and the family, and the nurse is responsible for going over the patient's medication, making sure they're taking the medication appropriately, and ordering more medication as needed. Short-term in-care patient care is for patients that are not managing their pain or the symptoms are unrelieved, so they come in through inpatient care for just a short term. Crisis intervention care is when a nurse might go out to the home and they can stay with the patient up to 24 hours, helping them over this crisis. Short-term respite care is for the caregiver. That's when you are bringing in the patient into an inpatient setting and giving the caregiver a break. And in respite care, this is more for the caregiver and not the patient itself, because as a caregiver 24/7, that caregiver usually gets tired and run down, so we need to make sure the caregiver is rejuvenating their self, and that way they can go back and take care of the patient again. Thank you today for listening to our presentation. We hope you enjoyed it and you have learned from this presentation. Have a good night.